The woman you're about to meet is incredible. Brooke Scott is one of you. She works in the Fraser Health region. She's a hospital librarian. She's a mom. She's a community member. She's an active citizen. She's a person who is healthy, and she lives in this world in the best way she can possibly live in this world as a community member who cares about people. And she suffered a tremendous loss in her life, and she decided that she wanted to say yes to this conference because she wanted to put her story in this room to allow all of us to think about what her story means to us as people who want to learn and do better as caregivers and community members for one another. Would you please put your hands together and welcome Brooke Scott.
I'm really happy to be here this morning. It feels like a very supportive room. I'm happy to see so many faces, some familiar, some yet to be familiar. And before I get into my story, I want to express my gratitude to all of you for being here today, for being open to this experience. I know you guys work tremendously hard at jobs that are often unforgiving and punishing and sometimes rewarding, and you keep coming back and keep trying to improve care. And I really sincerely appreciate that and want to express that before I begin. So I'm here today to share my perspective of my late husband's healthcare journey as someone with a substance use disorder. Most people are really shocked when I tell them how my husband passed away. And I probably don't fit the mold of someone who would have been married to someone who had a substance use disorder. I get that reaction a lot. And he, frankly, didn't fit that role either. He was always very well put together, well-dressed, perfect hair. He loved to debate, highly intelligent, despite the fact that he didn't do any post-secondary. He worked very hard as a manager at a high-profile company. And yeah, he just didn't fit that. And because of that, for the longest time, nobody knew about his substance use, except for me. I knew. So let's go back a little bit. In the spring of 2012, we became pregnant. And it was a planned pregnancy, but there was a little surprise when I went for the first ultrasound. We were having twins, which was super exciting for me, especially as an only child. I thought, oh my gosh, what am I in for? So we were excited, but then Jeremy's reaction, sorry, my late husband's name was Jeremy, forgot to introduce that fact. Jeremy's reaction was a little bit different than I'd hoped or expected. He was immediately overwhelmed, which is understandable, and then a little bit dismayed. And then that went away, and a few weeks later, it returned. And with that return of his worry came an old coping mechanism, which was substance use. He struggled with using heavy drugs as a teen when his parents divorced, and his drug use worsened and increased further after his father got sick and eventually passed away. This coping mechanism now returned full force, and he began regularly smoking crack and smoking heroin. And he was very insistent to me that he was just getting this out of his system before the babies arrived. He knew this wasn't something that he could continue with after the children were born, and he was afraid, and this was his coping mechanism. So he was true to his word. As their due date approached, he began methadone treatment after failing to quit cold turkey on his own. He was a very stubborn man. He thought, I can just do this. I'm going to quit cold turkey. Worked for a little bit, but then he realized he needed help. So he began methadone treatment. And like most girls, of course, or like most twins, our girls arrived early. And I still remember how poor Jeremy was very pale and sweaty as he came and visited us in the hospital because he was on methadone. It's a big side effect of it is to mess with your body temperature and your blood pressure. And the nurses kept asking me and asking him, are you okay? Are you sure you're okay? And I, being the dutiful wife who was keeping his secret, just kept telling him, oh, he's just not feeling well. He didn't sleep well last night. The same routine that I'd been used to. So Jeremy began seeing a psychiatrist in the community around the same time. This was through a referral from his GP. And the psychiatrist was supposed to be in place to monitor his progress on methadone and to assist with his recovery. Instead, what he got was someone who appeared openly bored in every single one of their sessions, rarely listened to what he had to say. And when Jeremy complained about physical pain, the psychiatrist prescribed him a large amount of clonazepam. So it didn't take long for Jeremy to start abusing this other highly addictive drug. He would run out of pills weeks before the scheduled refill. And at least 3 times that I know of, he called the psychiatrist's office and told him that he had lost his bottle of clonazepam. He never actually spoke to the psychiatrist any of these 3 times. And what happened was that the secretary relayed his message to the psychiatrist, and the psychiatrist promptly wrote a script for a large replacement bottle, faxed it over to our local pharmacy where he would pick it up. So after a year and a half of this routine, Jeremy's tolerance for both methadone and clonazepam rose, and he began smoking heroin again. With 2 toddlers now at home, I insisted that he check himself into a rehab facility. So together we investigated options and applied for a placement at the Maple Ridge Treatment Center. Then began the months of waiting. These were by far some of the hardest months of my life. I was trying to keep our children safe and healthy and happy. I was also trying to keep my husband safe and healthy and alive, and also to keep that secret from all of our friends and family was another one of my responsibilities because he rarely left the house. So I just kept holding on, waiting for that call that he was going to start inpatient treatment. That looming deadline of inpatient treatment caused Jeremy to use drugs more heavily. One night, it got so bad that I called an ambulance for him. I thought he was about to overdose or that something was terribly wrong with his health, more so than usual. So the ambulance drove away with him a few minutes before our girls awoke. So I got them dressed and fed, got them ready, brought them to daycare, and went to work. And for such an incredibly stressful day, for the first time as I sat down at my desk at work, I was relaxed, more relaxed than usual, because I thought, it's okay. He's in a hospital. He's being treated by medical professionals. He's not at home alone, which is my biggest fear. All day at work, I would just sit and worry about him and try and check in and rarely get an answer. And sometimes I would even rush home and check on him just to make sure he was okay. So I relaxed for a little bit. And then I was about an hour into my work when my phone rang. And it was my husband on the other line. He was barely intelligible. And after a little bit of trying, I finally understood him say that they'd kicked him out and I had to come pick him up. I later understood that they had given him some sort of infusion. I never found out what. And as soon as he was conscious and could walk, they told him he had to get out. So I drove over to the hospital, to the emergency room, and I spoke to the intake nurse, and I was a complete wreck. I was shaking, crying. I'd sort of reached my breaking point because I thought I'd finally relaxed a little bit, and then this new challenge was thrown up in my face. And I was so desperate to get him placed in longer-term care. I didn't think it was safe for him to be back home where he was alone for most of the day. So I asked her where I could find my husband. And the nurse looked at me and asked if I was all right. And I can close my eyes and remember that kind look on her face. And it meant the world to me in that moment. I said, no, I'm not all right. We're not all right. I need help. A few minutes later, she said, okay, I'll get someone for you. A few minutes later, a social worker came into the ER waiting room. And at this point, I was still waiting for my husband to come out. And I explained to her that we were waiting for long-term care, and that I couldn't bring him back home. I was too worried. This couldn't keep going on. So what can you do? What can you tell me about that I don't already know about? And she said, sorry, I don't have anything for you. You're going to have to keep waiting for that call from MRTC. And then she said, I'm going to have to report you to Child Protective Services. And that was probably the biggest blow that I received, because in just sharing and trying to reach out to this person, I thought, okay, this person has come specifically to help me and to give me options. And instead, she's given me punishment because I dared to share the fact that I have children at home. And yeah, it was really crappy. She said she was sorry, but it's part of her job. She has to do this. And we left. I took my husband home. And a few weeks later, I got a call from the Child Protection Service worker. And thankfully, they were very understanding. I explained my story in depth and that we were waiting for this placement. I was taking care of my children. My parents were in the picture, also helping take care of the children. She said, okay, I'm satisfied. So I lived in fear for those 2 weeks, though, that our children would be taken away, which is unbelievable to have to face that, as well as what we were going through as a couple. So I want to pause and talk about the shining light in this story, because there was one, which is I'm so grateful for. Our saving grace during this time was a counselor working out of Burnaby Mental Health and Substance Use Services. And I emailed him when I knew I'd be speaking here to ask him permission to share his full name, because he made that big of an impact on us. And David Gregson was a savior to my husband and to myself. He was the first person who listened without judgment to Jeremy, just let him speak and feel and not feel judged, not feel this total lack of empathy. And he helped him cope with and work through some of the pain of his childhood experiences. And every time he came home from an appointment with David, it was like there was a new light behind his eyes. He seemed lighter, he seemed happier, more relaxed, more hopeful, and I hadn't seen that in a long time. And so I always encouraged him to go to David as often as possible. This gave me hope too, much more than I had been experiencing up until then. So in the spring of 2015, we finally got that call from MRTC saying that he could be admitted. A week later, so he was admitted to inpatient treatment, and after about a week of being an inpatient, he was granted a weekend pass to come and visit us for the day. And I was completely blown away with the change in him. It was like he was waking up. I started getting glimpses of the man I had married. That was 10 years ago, 12 years ago. He told me about the conversations that he was having with the staff and the fellow residents. He told me about friends he had made, debates that he was having, because he was a staunch atheist, and so he loved getting into tete-a-tete with some of the more religious residents, and they would have these big debates, and he was in his element. He was really waking up. I almost couldn't believe how quickly he had transformed from being housebound with no friends. A couple of days later, on a warm, sunny day, one of the counselors at MRTC decided that they should have their session outside. It's just like when you're in school, right? Let's have our class outside. So they all got together and walked down the hill and across the train tracks to where there's some piers below MRTC. And Jeremy, still being full of life, back to his old self, kind of goofy, decided he would surprise one of his fellow residents by jumping from the upper pier to the lower pier. And being Jeremy, he decided, I'll do a backflip too. It's just insane. So he seriously misjudged the height, and he fell 20 feet, and he broke his ankle and shattered his heel. So he immediately had to stop inpatient treatment until that healed. And then began months of, so this was just the beginning of the summer, It was a big operation to put all these plates and pins and put his heel back together, his ankle, and then the plates and pins got so infected that the wound wouldn't close. So he was put on antibiotics, then IV antibiotics, got a line inserted. It was quite the ordeal. And meanwhile, he's trying to cope with this change in his path, right? So he'd been on this path, finally getting into treatment, getting all this life back, and now all of a sudden he's disabled physically as well. And it became clear, eventually he got a cane, which he would have probably needed for the rest of his life. He was hopping around the house, had to crawl up the stairs. But there was still that MRTC re-entry in the future once he had healed enough. So I was hopeful that we could just pick that up again. Before, if I just go back a couple of steps, before that second, or even the first operation on his heel, I decided that I would not go into the hospital unprepared again. And luckily, with my role at Royal Columbian, I knew of the pain management nurse practitioner. I thought, oh, this is perfect. Okay, so I know that he's got different tolerance to pain medication because of his substance use. And so we sat down, we had a very frank and open discussion about it. I was very hopeful that this would change that experience of being an inpatient as someone with a substance use disorder. So after that conversation occurred, I thought, this is great, okay, you're going in. And after he had the operation and he was an inpatient, it was like none of that had ever happened. There was, his goals of care whiteboard beside his bed was blank for his entire stay. I would approach the nursing station and either be ignored or told they had no idea what I was talking about. There was no pain management plan. So that was rough, being treated like either we were invisible or a nuisance. And yeah, my husband got the same treatment as me. It didn't matter. It didn't seem to matter. In the fall, Jeremy was finally stable enough to reapply to MRTC, and the reality of his new physical disability began to settle on him, and the impending inpatient rehab treatment loomed, which is, this pattern. If there's a big stress, so he began to use heroin again. But by mid-December, when he was checked into MRTC, he had been clean for several weeks. I was very, very proud of him for that. He was showing me and showing our daughters that he wanted to be clean. During both of his stays at MRTC, Jeremy told me about going for walks around the area. He would get a pass for an hour to go to the store. Every time he left the facility in Maple Ridge, he would be immediately approached aggressively by drug dealers in the area. Apparently, they just camp around there and wait for prey. He said the first time it happened, he threw up a couple blocks later because it was that intense of an experience to be faced with your greatest temptation and to walk away. On December 21st, he went for a walk and gave in to that desire, probably thinking he could get away with it one more time. The staff at MRTC had decided that he didn't need a roommate. In their words, he seemed to be doing so well. He was so well-spoken and well put together. And Jeremy could always put on a good front, even at his worst. So he went back to his room and smoked heroin that night. He overdosed and wasn't found by the staff until 11 a.m. the next morning. There was no fentanyl in the heroin that he smoked. It was just strong. And because of his weeks of sobriety and struggle for abstinence, it was just too much for his system. He was 36 years old. I've heard from a lot of healthcare providers that patients who struggle with substance use are hard to treat and they're hard to empathize with. They resist care or recommendations. Their behavior's erratic. They show up in the ER with the same self-inflicted crises again and again. I get it. My own husband frustrated me many times. He tested my patience. He pushed me to the very limits of my empathy when he was abusing drugs. If our hearts can soften just a little bit more to these patients, it will be felt, I promise you. It will make a difference. Every single positive and negative healthcare experience that we had was based around a central theme: being seen and heard with an open mind and an open heart. When this occurred, or when it didn't, we both felt it very, very deeply. I'm proud of my late husband. I'm not ashamed or afraid to tell people how he died. He chose to fight to overcome his addictions, and it certainly wasn't an easy battle. Thanks.